are often underfunded, so a lot of immigrants struggle to find affordable quality language class. And even if ESL education were more accessible, it would and if ESL education were more accessible, it would help break down a lot of these barriers and make immigrants feel more confident in navigating the mess of a healthcare system that our country have.
Hmm. Oh wow. Okay. So it does seem like ESL could be a long-term solution then for many issues apparently. But yeah, there are many problems as you just told me. But speaking of long-term solutions and everything, what are some policy changes you believe could create a more like inclusive support system for Asian immigrant communities?
I think that expanding Medicaid and other healthcare programs to include immigrants, regardless of their status or how long they have been in the country, would make a huge difference. Also, funding more culturally specific health programs or supporting bilingual staff in hospital and clinics is also essential. Additionally, we can create more inclusive public charge policies that could that can reduce the fear immigrants have when accessing these services. And I think that overall we need a targeted immigrant focused policy that address both healthcare and social social services holistically.
Okay. Thanks for those suggestions, Mr. Sun. What are other problems that might exist in this area that we haven't covered? Like the simple topic of just barriers preventing any type of immigrants or just anyone who isn't, of course, like nationally born or like domestically born in the US.
I think a issue that a lot of people don't often talk about is mental health. And in it's a huge need in immigrant communities because I think that as a first generation Vietnamese, Asian culture can sometimes be very toxic and place a huge burden on first generation kids. And it's right now the mental health care is underfunded or in not accessible to immigrant communities. And culturally there is a lot of stigma around mental health, and that can prevent people from seeking help. And it's a complex issue that is very important that I think we need to touch on.
Oh yeah. I can fully understand and like resonate with this. But finally, right? I just want to have one more question. Which I'll have to ask you personally. Who else would you like recommend I talk to for these issues? Like, is there any organization or connections that you can tell me?
Yes, it's great that you brought that up because there's a lot of other communities like us that are helping Asian Americans, and such as Asian Americans Foundation, Asian Health Services, or even the National Asian Pacific American Families Against Substance Abuse. They all have a focus on Asian immigrants communities and could provide additional perspective, especially on healthcare and social services.
Okay. Thank you very much, Mr. Sun. That should be all the questions I want to ask you today. This was a very like informative interview, and I appreciate you taking your time to share your insights with me.
You're very welcome. I'm glad to help, and I hope this information prove useful and can reach a wider audience to bring more light on the issue that we have touched upon today. Good luck to your research.
Okay. Thank you very much. Thank you very much. You have a nice day. You have a good night. Okay. Thank you.
You too.